Hello and welcome to Ask Dr. Gupta. Today we shall discuss a very common problem, that is pain in breast. Before I take the discussion further, I would like to emphasize that the information being shared here should not be used for self-diagnosis or self-treatment. The purpose of this discussion is to disseminate information for general awareness among ladies. Pain in breast is a very common problem, especially in the young. The prevalence varies according to ethnicity. According to published studies, about 70% of the ladies are troubled by breast pain during one or another phase of their life. It is so common that some authors consider it as a variant of normal and not as a disease. But how can pain be normal? It actually causes very severe discomfort and can interfere in job and also in married life. Whenever we see breast pain, then the first question that should be clarified is it actually pain in breast? Many a times the pain is somewhere else, it is not coming from breast and is mistaken for a breast pain. The most common condition that mimics breast pain is costochondritis. This is problem in the ribs close to the midline. Pain in the upper abdomen because of acidity or because of gallbladder problems can also be confused with breast pain. Sometimes something serious like pain of angina can also present as breast pain. This kind of pain may be seen after heavy physical activity also. Generally, a doctor will be able to easily pinpoint the cause of your pain. If there is actually pain that is coming from breast, then we need to find its relationship with menstrual cycle. A pain that comes in the mid of the cycle and is relieved by menstruation is generally seen in younger ladies and girls. It is sometimes part of generalized premenstrual syndrome and it resolves when the PMS is treated. It is due to increased sensitivity of the tissue of the breast to changes in hormones. Sometimes the tablets, the medicines that have hormones like hormone replacement therapy, they also can give rise to similar problems. If the pain is unrelated to menstrual cycles, then it is generally seen in relatively older ladies and women, mostly present on one side. Sometimes it is confined only to one part, mostly the inner half in the lower part. It is related mostly to some old injuries, to infections, or non-cancerous pathologies like dilatation of milk channels, cysts or mass in breast. It is seen in 30 to 50 years of age group. Sometimes if the breast size is very large, then it can pull the ligaments suspending them, the ligaments of Cooper, and can cause breast discomfort. There are some other reasons also that are not so well established, that is stress, high intake of fat, caffeine, smoking, and sometimes even antibiotics and some antidepressants. When we know that there is pain that is coming from breast tissue, then as we discussed in our video on breast lumps, the investigations are decided according to the age of the affected lady. In relatively younger ladies, the first investigation is generally ultrasound of breast. Mammography helps in those ladies who are 40 or above of age. Sometimes if there is anything suspicious seen on ultrasound of breast, then mammography might have to be done in younger ladies also. Tissue sampling, that is biopsy, is generally asked for when there is a mass which is seen on mammography or ultrasound. One thing should be clearly understood, that breast pain is generally not a signal of breast cancer. Pain comes in cancer only in late stages when it has affected either the skin or the bones. Many ladies come to doctor out of fear of breast cancer and not because of pain per se. They get relaxed once they realize that they are safe. Many of them do not pursue treatment further because their problem was not actually this pain but fear of cancer. This is not cancer. It does not mean it should not be treated. It can sometimes virtually bring life to a halt. Job can be affected, and as I said, married life can also be affected. The treatment generally starts with non-pharmacological, non-drug treatment. If it is due to the large size of breast, due to heavy breasts, then a well-supporting undergarment like a sports brassiere generally resolves the issue. Reducing the intake of coffee, chocolates, carbonated beverages, smoking has shown to benefit, though as I said, the relationship is not very clearly established. Painkillers are given on SOS basis. The safer painkillers like paracetamol are given in the beginning. If they are not effective, then diclofenac gel or diclofenac tablets can help. Generally, the breast pain resolves in 3 to 6 months. If it does not, then we have to start proper treatment, and this is started with capsules of evening primrose oil and vitamin E. They are generally successful. They help by maintaining a favorable balance of fatty acids in our body. If this kind of treatment doesn't work, then we have to give prescription drugs. They might have to be given. The prescription drugs include tamoxifen and danazol. But remember, do not take these medicines without medical supervision. They have their side effects also, and these side effects include uterine bleeding, joint pain, change of voice, and many more. If a pregnancy happens during this treatment, then the child that is going to be born has a very high risk of congenital abnormalities. Breast pain is actually a troublesome disease, but as we just discussed, it has a very good remission rate. Prescription medicines that I just mentioned are required in very small percentage of ladies. Most of them become alright either with SOS painkiller or with simpler treatments. So please do not endure the pain silently. Meet a doctor who knows the breast diseases and who knows the management very well, and relax. Breast pain generally does not signal breast cancer. We have discussed all types of breast lumps, cancerous and non-cancerous, in our video number 9. Breast cancer has been discussed extensively in video number 10 to 12. The symptoms, the treatment, the follow-up, everything has been discussed. In our next video, we shall be discussing discharge from nipple. So please stay connected. Thank you.